Thank you, Lindsay, for that kind introduction. I am really honored to talk about our research right here, the Alberta Diabetes Foundation and also the Alberta Diabetes Institute, and all the infrastructure and support have been really there helping us from getting my lab started back in 2019 in the form of startup funding to our trainee stipends. Two of them are here and really eager to tell you about their projects, to operation funds that enabled us to start our project from scratch through a pilot funding, which then led to a CIHR $1 million funding to study mechanisms in our preclinical models, and now recently to move into the clinical translation of that project together with Western Family Foundation, looking at breastfeeding and type 1 diabetes in mom and baby diets. So what we're really passionate about in the lab is studying how the immune system interact with our metabolic tissues, and also how metabolic diseases then reciprocally alter our immune responses against foreign threats such as cancer and infections. And so those are all key areas of our research pillar, but what my trainees and I have prepared for you today are on our projects looking at maternal factors that protect diabetes in the young. So with our pilot funding, we were able to discover that maternal milk and the antibodies that is contained within that milk can alter the bacteria that live in our guts. And that immune bacteria interaction then translate into differences in how the offspring develops diabetes. That was the first step that led us to ask the question, how does milk of a mom with diabetes differ from milk of a mom without diabetes? Literature tells us that the moms that have diabetes, when they have babies, they are actually protected from this disease. And we want to know what those protective factors are. So that is really at the heart of our research. We are going to be following mom and babies from third trimester up to 2 years of age, and hopefully even longer, to understand that maternal transfer of these protective factors to the babies, and how soon do they develop autoantibodies, how soon do they develop diabetes. And then we are going to then tease apart those factors, establishing cause and effect relationship using our preclinical models. So that is the talk or the slides that we have for you tonight, alongside other projects examining nursing, exclusive breastfeeding in mice, and also examining early life gut immune interaction as a potential predictor of diabetes before it even happens. So we really look forward to talking to all of you, and thank you again for having us. Thank you.